Hi, Caitlin. Hi. How are you?
I'm okay. How are you doing?
I'm good. Thanks for coming in. My name is Dr. Matt. I'm going to do your examination today. Before we go into full symptoms and what's going on with you, can you please verify your first and last name and your date of birth?
Yep. It's Kate C. ASMR, and it's March 4th, 1997.
Okay, perfect. Do you have any allergies?
I don't.
No allergies. Okay. And any relevant medical history?
No.
Any injuries in the last 12 months?
No.
Okay, so go ahead and tell me what's going on. Do you have any pain right now?
I don't know if I'd call it pain, but definitely a numbness and tingling sensation that I've noticed around my head area. When I go to put my head in a ponytail, I started to notice that I can't feel the brush on my skin in certain areas of my head. My neck as well, and kind of a tenderness in my face too.
Neck, face, you said scalp, and back of the neck. Okay, any recent infections?
No.
Okay. And are you taking any medicine on a daily basis?
Yep, just birth control.
Okay. And are you experiencing any pain or just numbing?
It's a numbing feeling, kind of pins and needles. Yeah.
Have you noticed anything abnormal with your sensations anywhere else on the body?
No, it's kind of just around my head area.
Okay. Any changes with your taste?
No.
Okay. Have you noticed any abnormal smells? A smell that is not there, for example?
No, I haven't.
Okay. Any vision changes? Do you see floaters or any double vision?
No.
Okay. And what about your hearing? Have you noticed anything out of the ordinary? Any buzzing? Anything coming out of the ear, like a liquid?
No, it's all been normal.
So it's very reassuring that you don't have any extra symptoms, but I do take this very serious. So I'm going to go ahead and do a vital signs check and also do a sensation test to make sure that we're checking your reflexes. Sometimes we could be missing some of the symptoms if we don't do those tests. Okay. So today is the perfect time to do it. Is this arm okay?
Yes.
All right. Okay, I'm just going to place this here on your palm. Okay. Okay, blood pressure is within normal limits, 123/70. And I'll check your heart and your lungs too. Okay, heart sounds normal. Can you go ahead and take a deep breath in and breathe out? And again, take a deep breath in and breathe out. Take a deep breath in and breathe out. Good. And again, take a deep breath in and exhale. Okay, so lungs and heart sounds are normal. I'm going to check your pulse as well. Okay, pulse is about 60 beats per minute. 2 plus. And I'm going to compare. Very good. So they are symmetric. Okay. I'm going to do just a neurological function of your upper arms. Can you please put your arms like this in front of you? Alright, so there's no shaking, no trembling. Okay. I'm going to try to push down your arm. Don't let me do that, okay?
Okay.
Good. Good. I'm going to try to push it up. Okay. And open it. I'm going to try to open it. Don't let me do that. Okay, go ahead and relax. I'm going to ask you to shrug your shoulders. I'm going to push down, okay? Okay, good. And now can you please look that way with your head? So turn your head that way. Good. And now go ahead and turn your head this other way. Okay. Can you please close your eyes? I'm going to try to open them. Don't let me do that. Okay, go ahead and lift your eyebrows up. Lift them up, eyebrows, all the way up. Good. Go try to push them down. Don't let me do that. Okay, very good. And can you please give me a big smile? And now frown. Okay, so really frown with your eyebrows, okay? Not with your mouth. Okay. Alright, that's good. And can you please stick your tongue out? Good. And move it up and down and side to side. Good. Now go ahead and push with your tongue inside one cheek and the other one. Okay, very good. Go ahead and close your eyes and tell me with which ear you hear this sound.
Left. Right. Both.
Okay. And can you please tell me if you feel this equally on both sides? Go ahead and keep your eyes closed.
Yes. Yes. No.
Okay, and which side you felt it more than the other?
On the left.
So you felt it more over here. Okay.
Same on the left. Both. 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 Both.
Okay. I'm going to ask you to relax your jaw a little bit more. Open it. Perfect. Okay, good. You can go ahead and close. Okay, go ahead and uncross your legs for me. Okay, so there's a decreased neurological response on the right side. Okay, that was better. I'm going to check your pupil size. Can you please look right here? Okay. Go ahead and close your eyes and tell me when you don't feel this vibration anymore.
No. 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 No.
Okay. Can you please tell me if this feels cold or warm?
Cold. Warm. Cold. Cold. Warm. Cold. 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 Cold.
Okay. And does this feel sharp or dull?
Dull.
Sharp or dull?
Sharp.
Okay. Go ahead and tell me if it feels sharp or dull.
Dull. Dull. Dull. Dull. Dull. Dull. Sharp. 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 Dull. Dull. Sharp. Dull. Dull. Sharp. 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 Dull. Sharp. Sharp. Dull. Sharp. 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 Dull. Dull. Sharp.
Okay. So there is some inconsistencies with your answers. Definitely on the right side, there's some loss of sensation. You were able to distinguish the temperatures, but the pressure ones were a little bit more difficult on the right side. And is it okay if I palpate your scalp to see if we need to do a checkup there as well?
Yes.
feeling any bumps or anything like that. I'm going to take some measurements to see if there is any inflammation or asymmetry. So I'm looking for muscular atrophy. That could be an indication of nerve damage. I'm noticing some asymmetry on the right side. So I'm wondering if it's a tense muscle or a pinched nerve. Okay, can you please go ahead and close your eyes and tell me if this feels sharp or dull?
Dull. Sharp. 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 Dull. Dull. Sharp. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Sharp. Dull.
What I would like to do now is I'll have you lay down and I'll check your neck and your scalp where you mentioned that you're having some difficulty with your sensations, okay? I'm going to go ahead and palpate your lower back to see if I feel any pulsations here. Okay, does feel good. Doesn't seem to be a lot of inflammation, so what I'm gonna do is I will pull a little bit the skin to see if there's any kind of sound. Okay, so that's good. Okay.
Okay.
Okay, the back of the neck is where you mentioned you're having that loss of sensation, and it's more on the right side than the left. You mentioned there's no painful stimulus, and to me it looks more like an impinged nerve. Now we're gonna have to work on the muscles as well to relieve some of that inflammation. I'm going to also check your scalp area. So I'll take a look at the hairline first. Okay. Does that feel sharp or dull?
Dull.
What about now?
Dull. 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 Dull.
Okay. And does this feel warm or cold?
Cold.
Warm or cold?
Cold.
Does this feel the same intensity as the first two?
Yes.
Okay. Let me know if you feel the intensity getting less or more as I'm moving down the hairline. Okay. Does this feel sharp?
Yes.
And is this the same amount of sharpness?
Yes.
Okay. Does this feel sharp?
Yes.
What about now? Does it feel sharp?
Yes.
And now?
Yes.
this feel warm?
No.
Does this feel warm?
No.
And does this feel warm?
No.
Okay, can you please tell me if this feels sharp?
It does not.
Okay, what about now?
No.
Okay. And can you tell me if this feels dull?
Sharp.
Okay. And what about now? Is it dull?
Sharp.
And what about here? Is it dull?
Dull.
It is dull.
Yeah.
Okay. Can you please tell me if this feels warm?
Cold.
What about now?
Cold.
Okay. And does this feel sharp?
Dull.
Is this sharp?
Yes.
Does this feel dull?
No.
What about now?
No.
And here, does it feel dull?
Yes.
It feels dull.
Yes.
Okay, does this feel dull?
Yes.
What about now?
Yes.
And now?
Sharp.
Sharp on the lower side. Okay, does this feel sharp?
No.
Does this feel sharp?
No.
Is this dull?
Yes.
Okay. Is this sharp or dull?
Sharp.
What about here? Sharp or dull?
Sharp.
I'm noticing some abnormalities on the hairline on the left side, and I'm going to go ahead and do some adjustments on the scalp. See if we can relieve some of that impinged nerve and to articulate the muscles to activate them and decrease the pain. Okay, I'm going to use my thumbs here to find exactly where the inflammation is. So you're just going to feel my fingers touching you. Sometimes I'll apply some pressure, and if they turn red, then we'll know that we need to work on those pressure points. I'm going to use a sensory brush to stimulate the nerve endings. So I'll be focusing on the hairline, moving up the scalp. I'll also be taking some samples here to check them for any inflammation. I'm also looking for any raised bumps. Okay, we're going to send that to the lab, and I will work on your neck area as well. So I'm noticing there is a little bit of inflammation here. I would like to maybe get an MRI to check for any tissue damage. So first I will find the trigger points and apply some gentle pressure. That usually helps to alleviate nerve impingement and that loss of sensation that you're feeling. I'm going to work on the fascia as well. So you're going to feel multiple pressure. I'm not going to apply too much but also it will not feel too gentle either. This usually helps to remove toxins. Okay, you're doing great. This is gonna feel kind of sharp. I'll be applying some anti-inflammatory oil at the base of your hairline, and then I'll massage it in. I usually recommend to not wash your head and your scalp for the next 24 hours. Okay, very good. Well, thank you for coming in, and I will see you back in about 5 days. Is that okay?
Thank you.
You're welcome.